Welcome to Healthcare Workforce Unplugged, a medical solutions podcast. I'm your host, Kristen Dahl. If you've ever felt like you're carrying the full weight of workforce challenges on your own, today's conversation is for you. For many healthcare leaders, workforce management doesn't feel strategic. It feels constant coordination, constant problem solving, constant pressure. And too often, the partners meant to help are sitting on the sidelines instead of carrying that weight with you. In this episode, we're talking about what healthcare leaders need from a workforce partner and why the difference between a vendor and a true partner changes everything. I'm joined today by three incredible leaders who bring different perspectives to this conversation. First, Kareen Selfers, Chief Client Officer at Medical Solutions, partners closely with health systems across the country to design workforce strategies that go well beyond traditional staffing. Next, Natalie Red Eagle, Vice President of Clinical and Quality Services at Medical Solutions, brings a clinical lens, connecting workforce strategy directly to quality outcomes and patient care. And Dr. Charles Dolan, Vice President of Clinical Operations at Tidal Health, offers the provider side perspective with decades of healthcare leadership experience and more than 30 years as a paramedic, grounding this conversation in real world operational and frontline insight. Thank you all for being here today.
Thank
Thanks for
you.
having us.
Thank you.
Between the three of you, there's a lot of experience in how workforce decisions actually play out, both operationally and on the ground. So I'm really looking forward to this conversation. Let's start at a high level. We hear a lot about moving from a vendor relationship to a true partnership, but that shift means different things depending on your role. Dr. Dolan, from your perspective, what does a true workforce partner look like to you today? And how is that different from what you may have experienced in the past?
Yeah, that's a great question. I think, one of the challenges, coming out of COVID was the workforce was just a mess. And so for me, trying to run a health system, we need to have a partner, not someone that's just a vendor, kind of to what you were alluding to. So I think the challenge for me was we had to find the right person and the right team and the right organization. I think of workforce vendors in the past as transactional. So we would send them a requisition, they would find someone, and we would fill the gap. What we need today and what my teams need today is a partner, somebody that's fully integrated into our system that you can't tell that they work for an outside entity. And to me, that's what's really important. It's seamless. I don't want nursing leaders to be stressed trying to get their requisitions, interviews completed, clinical reviews, all those things that have to happen in order to bring in some temporary labor. So for me and for them, it needs to be fully integrated, operational, and easy.
Yeah, absolutely. That's such a great perspective. Kareen, I'd love to get your take on this because you've worked with many of the healthcare leaders in our client base. From what you've seen, how have expectations from healthcare leaders changed when it comes to workforce partners?
So Dr. Dolan just said a lot of really great things. I'm smiling because I am definitely experiencing many of the things he was mentioning across, the health systems that we work with. So what I'm going to say, first of all, what we're observing is our clients prefer to work with fewer partners rather than many. I would say there's a lot of consolidation ongoing. And so that's one trend we're definitely seeing. And I think that ties really nicely into what you said, Dr. Dolan, right? Like moving from a transactional vendor to a strategic partner. So if you have fewer partners, you want to have more strategic partners. And then on top of that, you want those partners to truly understand your organization, your pain points, your issues, and you want them to help you solve those issues, right? So I truly see that evolution from a transactional vendor to a consultative relationship.
Yeah, that makes perfect sense. Natalie, I feel like you're the perfect mix here. You've been on the floor experiencing some of the same things that Dr. Dolan mentioned, and you've also worked with many healthcare leaders in your current role. From your time with clinical teams and as a clinician yourself, can you explain what you've heard in terms of frustrations with traditional staffing agencies? And maybe talk a little bit about the disconnect between what hospitals need and what they're actually getting from some staffing partners?
Absolutely. And I second everything Dr. Dolan and Kareen have said so far. I think what's interesting from my lens is I've worked both sides of this. So I was in acute care nursing for a decade and still actually moonlight there. And then I'm in healthcare staffing leadership as well. So seeing both sides has been so fascinating. And from a broad industry perspective, we are seeing the need to shift into a true partnership and away from transactional staffing, and that got to be the trend during the pandemic, as Dr. Dolan said, right? People were just trying to fill quick needs. A lot of times, speed took precedence over quality. And we felt that on the floor. Your nursing personnel, your clinicians totally felt that. So, what we're seeing now is the most successful staffing companies are the ones who were invested all along, that understand their facilities partners' KPIs, the financial realities that they live in that roller coaster, right? The clinical goals they set for themselves, regulatory standards, and they're committed to supporting them through the entirety of that, not just filling shifts.
Yeah, absolutely. I'm sure that a lot of this is resonated with our listeners. One of the other themes that we hear quite a bit about is that true partners don't sit on the sidelines. Dr. Dolan mentioned that a little bit. They embed themselves in their organizations. So, Kareen, would you mind talking a little bit about what that actually looks like to be embedded in a health system's operations?
Yeah. It's easier said than done, I'm gonna say, right? Like, cause you do need a willing client or a willing partner that openly is willing to share a little bit more what's going on under the covers, right? Under the hood. And for that to happen, you have to build a trusting relationship as a foundation first, right? That doesn't happen from day one. And when we achieve that, when we achieve to be a trusting partner and we can be more honest and open with each other and share information, then we essentially become an extension of the teams of the healthcare systems or clients that we have, and that's the best of all, right? If we can be an extension and work alongside clinical HR or operational leaders in helping them achieve their goals. For that to happen, we do need to understand their operations. We need to understand, the environment that they live in. So it all boils down to being present and engaged and being that consultative partner and really going from being reactive and transactional to being strategic. But like I said, I think the bottom line is to be embedded, you have to earn that. You have to earn the trust and you have to be open and honest with each other and exchange information for that to happen.
Dr. Dolan, back to you. From your standpoint, why does that level of integration matter?
For us as a health system, it matters because we are very busy. All managers, leaders, vice president, no matter who you are, clinical staff, everyone's busy. We've had in our area something that we're not seeing everywhere around the country. Our volumes have never decreased. It's only gotten worse. So we're busy. I think what our team is looking for and what we need from our integrated partner is a way to quickly navigate getting the help the team members need with gentle pushback from our partners when needed, and maybe some guidance because sometimes we think we know everything as health systems and we do not. So we need our integrated partner to do that. I think it's important. Our team members want, again, the leaders tell me all the time how easy the process is here at Title Health. They don't have to, it's a completely electronic request process. It goes through our internal processes to be approved, and then it kind of seamlessly just happens. And, I think that is what teams are looking for. They need seamless, painless, fast, integrated partners to help us get this work done. And honestly, it has to be that way. The patients of our clinical leaders is not like it used to be. They're busy, they're in staffing, they're taking groups. So the expectation for them to have to screen, every applicant just doesn't exist. And you can't do those activities without an integrated partner to understand what each unit's clinical needs are, maybe the patient populations. And so that's why this integrated partner and not just a vendor is critical. And it's something that we demand. It's something I demand as a vice president of our health system. And I wouldn't partner with anyone who wouldn't be willing to do that level of activity. So for me, that's what we have to do. And our teams love it. I get great feedback all the time on this integrated partner kind of relationship that everyone's talking about.
Things are always getting busier and never slowing down. Another key shift that we're seeing is moving away from one size fits all solutions and listening before solving issues. Natalie, how does that show up when you're thinking about clinicians and quality?
So when I think about clinician and quality perspectives, it's incredibly complex. And I love that Dr. Dolan talked about this and what we're doing well, because it really is on the partnership, but also the staffing agency to absorb that complexity and make it simple for the facility partner, at least as simple as it can be, right? Because quality is not one size fits all. It's about being flexible. What a unit needs today, right, at Dr. Dolan's unit may not be what that unit needs, same unit, 6 months from now. Think about the evolution of the patient care, how much more complex they are. So you have to be able to ebb and flow and to meet those needs, which is super hard to do unless you're integrated and embedded in the organization that you're partnering with. And when you have those strong relationships, that level of integration, you can really shift alongside the facility, help meet their needs, and even suggest things proactively. I love Dr. Dolan's example again, where maybe we notice, hey, our clinicians are saying that the patients on this med surg unit are becoming more complex. Are we sort of leaching into more of a telemetry type skill set now? So sometimes we're driving that strategic conversation. And I love, love, love that we are doing this during Nurses Week because you can see how clinicians, even our travelers, can contribute to the culture if they're set up for success. They mitigate the turnover at our partners' facilities, right? If they're well staffed and ultimately support the core staff and the morale. And when they all are set up for success, their ability to learn and be successful, it's a better work environment for all and absolutely better patient care, which is what we all want.
Yeah, absolutely. Shifting gears a little bit here, for those who listened, our last episode focused on reactive staffing decisions. We spoke with Chase Farmer, our Chief Commercial Officer, and Aaron McKenzie, our VP of Solution Engineering, and they talked about the hidden cost of reactive staffing decisions and what healthcare organizations can do to avoid some of those pitfalls. Corrine, can you tell me from your perspective, how important is it for partners to anticipate challenges rather than react to them? And how can
Mm.
they go about doing that?
Yeah. Yeah. So definitely, first of all, super important. I'm sure Dr. Dolan here agrees that the best partners are those that anticipate for you and guide you in the right direction. So one simple example that I can think of that my team and I are constantly, having to monitor is rates, right? Or scarcity of roles or availability of the right talent in a certain location, right? And it's our job to frankly keep monitoring the market. We have such vast access to information through all of the clients that we service. And that information is powerful for our clients to know and for us to bring to them and share, hey, we're seeing these needs in these markets. We looked at your historical data and we anticipate you need X amount of roles, for instance, right? Like that's the kind of proactive, not reactive information that we should bring to our clients as a partner.
A lot of what you said leads into my next question. So it goes kind of beyond that business relationship into the human side of partnership, having those conversations, that open communication. Natalie, I'm curious from a clinical perspective, how important is that human communication and connection?
Yeah. Our human connection, the aspect of partnership is irreplaceable. It's table stakes, right? At this point, I think there's a lot of exciting, bright, and shiny toys out there when you look at AI and technology. It's easy to get like really distracted on that. And the innovations are, just that. They can transform our workforce. So I think it's natural that we're leaning into that to really help our partners and help stabilize the workforce. But you can't lose sight of the human side of things or we won't be successful. Today, it really has to be both. You have to be advancing technology to support predictive analytics for our partners, like Dr. Dolan said, right? Helping drive some of the changes maybe before they know about it. But you also need to keep your white glove service and your human support that sustains the partnership the entire way, that the work being done is supported by that human connection. When you really bring those two things together, the tech and human connection, that's the model that's going to support and scale, protect our patients. And it's what's going to make a staffing partner differentiated from the rest.
We're about 20 minutes in. I was waiting for the first mention of AI. It's hard to have a conversation these days without bringing up AI. So I appreciate you mentioning that, Natalie. I also wanted to get Kareen's perspective. Can you explain and expand on that a little bit on just the right way to build relationships that go beyond contracts?
I think it's all about walking the talk. It's about consistency. It's about reliability, right? Like it's also being accessible, making sure our teams are always available when our clients need us, and communication. I think that is tremendously important, that we are clearly communicating on a frequent basis with each other, and simply executing to the best of our abilities. Honestly, I think it's the hardest part, right? Like, but it's so critical to build relationships and trust, and to me that is the one thing that makes or breaks the best relationships.
Yeah, there may be some leaders out there who are listening and hearing some of this and thinking, wow, I am not experiencing that with my current workforce partner or staffing vendor. But switching partners can feel risky and it can be a lot of work. So, Dr. Dolan, can you talk about why it's worth the shift from a staffing vendor to more of a workforce solutions partnership?
Yeah, and I'll take you guys back in time for a minute. So when I was at another health system, I truly dealt with the transactional workforce vendors, plural. And I think the challenge is there was never a connection. There was never the detailed kind of conversations, the relationships. I mean, in this integrated partnership, I know my people and they know me. I consider them our employees. They're part of our team. I don't see them any differently. They're just not here in this building.
Mhm.
And so for me, that is critical. I mean, you have to have that connection. You need to have that integrated vendor. The transactional vendor doesn't work. And as an executive in another system where I had that, it was miserable. It was miserable. We did not have good outcomes. We did not have open dialogue. And so it's not about the contract. That's a piece of paper, right? So, and sometimes the contracts aren't worth what they're written on. But I can tell you, when you have an integrated partnership, I don't even think about the contract. It doesn't cross my mind. I don't say to myself, "Oh, well, let's go pull out the contract and let's remind ourselves what the expectations are." Our expectations are bi-directional with our integrated partner. So there's no guess, there's no ambiguity, there's no blurriness. Like we know, and we treat each other like we're each other's partners, and we are, and that's how it needs to be.
Perfect. Well, this has been a great discussion. Before we wrap up, I'd love to hear one key takeaway from each of you. For our listeners, what's the one thing you would like them to take from this conversation? Kareen, let's start with you.
First of all, I want to say that I love what Dr. Dolan said about I don't want to look at the contract. I couldn't agree with you more. I'd rather never look at contracts and truly, deal with the issues at hand on a bilateral basis and have a good relationship. So I really echo that. Yeah, my key takeaway from this discussion that I really want to hone in on is be open about your pain points in your organizational goals to be achieved. The better we as a partner understand your organization, your goals, your pain points, the better partner we can be. And the more we can tailor our workforce solutions to your specific needs. So that's not always an easy thing to achieve, right? Like we have many partners that keep their cards close to their chest. And then that makes it more difficult. And I understand that. Like there's always circumstances like that. But the partnerships that I can think of also in my past life in different industries are those partnerships where we can be very transparent with each other and we build that trust. And as a result, we have a common understanding of the goals that need to get done. And as you say, Dr. Dolan, we become an extension of your team. And that's when we are most successful.
Love it. Natalie, do you want to go next?
Yeah. Kind of jumping off what Corrine said too, back to the one size fits all, right? You have to have a partner that's really willing to dig in and understand what your unique needs are and is able to ebb and flow with you and drive some of the strategy alongside you. If you really have that synergy and that true partnership, it trickles down to the unit level, down to the staff. They really can feel that. And that ultimately leads to better outcomes and better patient care.
Thank you. Dr. Dolan, last but not least.
I think my key takeaway for all healthcare executives or leaders out there that have a partner and maybe you're not happy with that partner, go find one that will do what you need. They do exist. I can attest. We've been in a long-standing integrated relationship. And I would say don't tolerate mediocrity from your vendors. If they're not meeting your needs, don't be afraid to change. I know as human beings, we don't like change, but it's okay to go find a vendor that's going to meet your needs and integrate fully with you. And again, back to what everyone else is saying, it has to be open and transparent. They can't help us if we're not transparent about the reality, and we can't help them if they're not transparent. So it's a bi-directional relationship, and that's what it is. It's a relationship. It's so that's what I would say to anyone. If you're hesitant or you feel like you're in a place that's not working for you, take the leap. Go find a partner. Spend some time. Don't look at the numbers. Don't chase the contract and the legalese. See who fits with you. I mean, if you can talk to that other partner and you're like, that's them, you'll know. And that's what I can say about our long-standing relationship with our integrated partner.
Great advice and great note to end on. This has been such a valuable conversation. What we're hearing loud and clear is that the future of workforce solutions isn't transactional, it's relational. It's about shared accountability, proactive problem solving, and a deep alignment with the goals that matter most, supporting clinicians, and of course, delivering exceptional patient care. Thank you to Corrine, Natalie, and Dr. Dolan for sharing your insights and perspectives.
Thank you.
You.
And thank you to our listeners for joining us on Healthcare Workforce Unplugged. If you found this conversation valuable, be sure to subscribe and share it with your colleagues. For more information on medical solutions, head over to our website, medicalsolutions.com. We'll see you next time.